these 2 pages. And everyone is okay. I talked about caput succedaneum. Everyone knows caput succedaneum, crossing the suture line. Page number 33. Cephal hematoma is not crossing the suture line. Which one takes longer to, for cephal hematoma, takes longer to disappear, about 3 to 4 weeks. Now I'm going isolation, hepatitis A. And also write down hepatitis A and E is contact precaution. So remember what precautions you will take? Contact. And what is the meaning contact? Because it goes from the hand, fecal, oral. Hepatitis B, C, D is blood. And what would you go B, C, D? Standard precaution. What is standard? Everywhere when you come in contact with blood and body fluid, wear the gloves. That's all it. But contact precaution is a little different. Wear the gowns, wear the gloves, and don't move anything from patient's room. Low magnesium and creatinine is high in renal failure. I want you to write down what are the things are high in renal failure. Kidneys are failing. And what is it high in renal failure? Is, remember the word, they have low urine output, number 1. Number 2, you remember potassium level is high. What is high? Potassium. What is high here? Phosphate level. Phosphate is high. And what is high here is BUN and creatinine is high. What is low here is calcium, and they are saying magnesium level is low. So low magnesium level, but creatinine is high. I want you to also write down with the word high is potassium, phosphate, BUN, and creatinine. Those are very high. And next word is called is pain. Next line, patient with rheumatoid RA. What is RA? Rheumatoid arthritis. What isolation? You will go rheumatoid arthritis. Reverse isolation. So highlight the word reverse isolation. And what I want you to write down, rheumatoid arthritis is systemic inflammatory disease. And they're not only having a pain, but it's affect inflammation throughout the body. And write down the word, it's immune system disease. They have very low immune system. That's why you're putting them in reverse isolation. Teach them to prevent infection, from infection. And they can damage their eyes, kidney, lungs, heart, every organs can damage. And what medication do you give them for rheumatoid arthritis? Anti-inflammatory medication. You can give them steroids. You can give the medication Enbrel. Write down the word Enbrel. E-N-B-R-E-L-L. Humira. H-U-M. Humira. H-U-M-I-R-A. Humira. Enbrel. And before you give these 2 drugs, check them for infection. If they have any infection, a lot of them before they give, they check them if they have been exposed to TB. They have any TB infection. So before you give Enbrel, Humira, that's anti-inflammatory medication. You can give them steroids. You can also give them cancer medication, methotrexate. Some of your question might see the word methotrexate. So remember, it's an anti-inflammatory. What is anti-inflammatory? Aspirin, right? Naproxen, you can give them. So remember, when you are learning something, whatever comes, write it down, memorize. So what is rheumatoid arthritis? Everyone should know is reverse isolation. And what is their problem is they have low resistance, their risk for infection. What are you reducing here? Inflammation. And what test do you do for them to diagnose is rheumatoid factor. Number one, rheumatoid factor, ESRANA, is blood immune system. They're checking. ANA is, and our rheumatoid factor, ESR. These two are very important that you know rheumatoid factor. ESR, erythrocyte sedimentation rate. So we know rheumatoid arthritis, reverse isolation we are putting in, prevent them from infection. Next is TB. TB patient, underline the word, you need to report public health. It's a public health problem. And when your patient has TB, is your airborne precaution. How do you diagnose TB? Is by sputum. Acid-fast bacillus. I want you to remember acid-fast bacillus. Acid-fast, patient is admitted acid-fast bacillus, or they give the word mycobacterium. Mycobacterium is TB. So patient with mycobacterium, acid-fast bacillus, that means the risk for infection. And they are risk for TB infection. And what do? They need to put in reverse isolation. So TB is a problem with the patient. Level of consciousness. Next is level of consciousness. You monitor your patient with a status epilepticus. What is status epilepticus is? Long seizure. Patient is having long seizure. Which patient would have long seizure? Patient who has seizure, they're not taking medication. We use the word non-compliance. Non-compliance means somebody is not taking medication. If they give you a question, you have a seizure patient and patient stop medication, a patient refusing their medication. How do you write in your care plan? Non-compliance. Are we clear? That's one of the problems. Number two, alcohol withdrawal patient can go in bad seizure. Number three, head injury patient can go in long seizure. Now what do you monitor for them? Level of consciousness, write down airway. What medication do you give them are Valium. Write down the word Valium. Write down the word Ativan. Ativan you can give them. Valium is more anxiety. Ativan also, it lower the anxiety means it lower the muscles and relax them. So those drug is good. Crackle is noticed in pneumonia. There's a fluid, and what is pneumonia is causing hypoxia. Underline the word. And what do you give pneumonia patient? Check breathing, right down there. And what kind of breathing? They have fast breathing, tachypnea. And what are you monitoring them for? Breathing and oxygenation. Next is patient cannot cough, meaning they cannot clear their airway. Cannot cough, they will have problem in breathing, airway problem. When you are coughing, you're clearing up all your lungs. You cannot cough, you cannot clear, you cannot breathe. Absence of menstruation, menopause. Menopause lead to osteoporosis. Why? Underline the word is and write down estrogen level. So remember, what is low here? Hormones. Estrogen is low. Sometimes they don't give and say, why does older people have the risk for fracture because of low estrogen level? What are the other reasons I mentioned for calcium R in your patient teaching? Cut down smoking, cut down alcohol, ambulation, walking around is good. When you are sitting, watching TV all day, not ambulating, you are losing calcium, okay? So that goes in osteoporosis. I want you to write down when you're giving steroids, lead to risk for fracture. So remember how you connect your question. Patient who is not walking, patient who is smoking, and these are all your teaching questions. And remember I said the word not only osteoporosis, There's a word osteopenia. Osteopenia, poor bones. That's another word. Toddler. Toddler wants autonomy. Autonomy versus shame, according to Erikson theory. And what is toddler are? They want independency. They want to do their own thing. And that's why they have autonomy. What is common in toddler? Separation anxiety. What age group is toddler? 1 to 3 years of age. And safety is very important. Temper tantrum is common in toddler. What is temper tantrum you do? Ignore them. They want attention. Next is low hemoglobin and hematocrit. Your lab results came and patient hemoglobin was last time was 12 and now is 9. And they may ask you what test you should do for your patient. Maybe your stool test, occult blood, because it's bleeding. So what do you check? Check the color of the stool and write down the word occult blood. Okay? And laxative. Next is IVP. I think we had this somewhere yesterday. Intravenous pyelogram, IVP. And when your patient is scheduled IVP, means they're looking for kidneys. Write down the word. P means pyelogram. Pyelogram means they're assessing kidney. What do you give them? Underline the word laxative. I want you to write down on the top enema. That means you got to clear your patient because your kidneys are in the back. You cannot see the kidney, IVP. First answer, give them enema. Second thing you remember, pyelogram. They're using iodine, gram word X-ray, and they're using check for allergies. What do you tell patient when they use iodine? I want you to write down they feel hot, flushed, and salty taste. They feel very much salty taste. These three answers are important. So please add that. IVP means is patient is going for intravenous pyelogram. Next is patient with cirrhosis. When you have liver cirrhosis, write down they have edema and ascites. Write down the word ascites. Ascites, lot of fluid in the stomach. And also, what do? Help them ambulate, elevate them, and write down the word. When they are saying ascites and edema, in your diet, you cut down sodium, you cut down water, you must weigh them, check their weight, and also when you have liver cirrhosis, that means you are cutting down the and what diet do you cut down in liver cirrhosis? Protein. What is high here? Ammonia level. And we are cutting down protein. And remember, any diet with the protein you don't give. What is the word is called when it's affect the brain? I want you to write down the word encephalopathy. Encephalopathy and neuropathy is the nerve. Neuropathy, encephalopathy. Patient has encephalopathy with liver cirrhosis, you definitely cut down what is protein. Encephalopathy means is affecting the brain. Neuropathy means the nerve. And what diet do you cut down here? Protein. Next is Addison. What is Addison disease? What is Addison disease is? Write down there, adrenal gland. What is low in adrenal gland is the steroids. Are we clear? What is low here? Steroids. What do you and you are not getting enough steroids. Second line, adrenal gland you have highlight, and they can go in crisis. So what do you teach them? Managing stress. What do you tell them in your question? Avoid stress. If they go in stress, what will happen? They're going into crisis. Underline that word. What is in Addison patients are, underline the word hypotension. I will write down here. They have low sodium, low sugar, low blood pressure, and what is high potassium, what is high calcium, and what is, they are losing here weight. What is low here are steroids. Everyone should know that you have to treat them by steroids. Are we okay? So what are you teaching your patient who has Addison? Avoid a stress. Hypotension, underline the word adrenal gland, crisis word, and a stress word. Patient with pancreatitis, what do you teach them? Remember, where is pancreas? On the left side, left upper quadrant. What happened to the patient with pancreatitis? Very much pain, and they get pneumonia because they're not breathing hard and they're laying. So what do you teach them? Very important in your teaching question. Cough, deep breathing, exercise to prevent pneumonia. What is the best position for patient with pancreatitis? Fetal position. They're laying on the side and they're holding the stomach. NPO, very important. For pain, what do you give them? Demerol. What are the signs you monitor for pancreatitis? We have done that. Cullen's sign and Turner's sign. What does it mean? They're bleeding. Are we clear? And also low calcium. You got to connect together. We have done another page. You must remember Cullen, Turner sign, exercise, pancreatitis. What do you give them? Pancreatic enzyme. What do you cut down in the diet? Fat. And what do we give them? Fat soluble vitamin. A, D, E, K. I want definitely write down on the side bleeding question, monitor. They are also risk for bleeding and low calcium. Next is safety. When you have depressed patient, there are two things. They're depressed and they're not eating. But what is it important if you have nutrition and safety? Because depressed patient risk for suicidal. So your first priority is monitor for suicidal. Next page, 34. Prolonged hypoxemia. Hypoxemia, oxygen level is very low. And what do you monitor your patient? Cardiac arrest. Fluid volume overload in CHF. Let me write down again here. There are heart sounds. S1, S2 is normal. I will write down, everyone should know, we all are nurses. S1 heart sound, S2 heart sounds are, what do you hear is the word love and dub. And S1 is AV valve closing. What is your AV means? Atrium and ventricle valve. What are the two valves are? Tricuspid and bicuspid valve, and that is bicuspid is called mitral valve. And where is it? In between right side of the heart, atrium and right ventricle. This is on the left atrium and left ventricle. So we say S1 you hear is a normal heart sound. What is a normal heart sound? You hear lub dub. And what valves are closing? This is the valve. But you have two valves. What are the two valves are? You remember tricuspid is on the right side and bicuspid is on the left side, between atrium and ventricle. Are we clear? So that is S1. What is S2 sound are? They're closing semilunar valve. They are semilunar valve. There are two valves. One in the is pulmonary artery. One valve is in pulmonary artery, but where is pulmonary artery is in the right ventricle. Second one is aorta. whereas aorta is in the left ventricle. We must know, and these are closing. So when you're closing AV valve, you hear S sound. When you're closing semilunar valve, you hear is normal sound lambda. But what is S3? S3 you hear in patient with CHF, and you don't hear lambda, very soft voice. S4 you hear in coronary artery disease. So these are not normal. Everyone is okay in your question, which are your normal heart sounds are? S1, S2. Which is your abnormal sounds are? S3, S4. So it says here, fluid overload or IV. When you have CHF can cause S3 heart sound. And write down S1, S2 is normal. Coarctation of aorta. What is coarctation of aorta? Write down the word narrowing of aorta. So what happened, the normal aorta, as the aorta is moving down, it becomes narrow. And what does it cut down? The blood supply. So what do you feel in coarctation of aorta? Upper extremity, that means your hands and face has more circulation. Your legs and lower extremity. So in your question, upper extremity, the blood pressure is high. And you have here in your notes, bounding pulse in the arm. That means good pulse. Feeble pulse are poor. So your blood pressure is high. Some question they will say face is flushed, face has a lot of circulation. Patient may have nose bleeding because the blood pressure is high. And the word is called is epistaxis. So sometimes their patient has epistaxis, could be with coarctation of aorta. Upper extremity means hands and face. Lower extremity, they're not getting enough circulation. So lower extremity, the blood pressure would be low, and also maybe the pulse is feeble, and the extremity may be very cold because they're not getting enough circulation. So what is coarctation of aorta? Narrowing. And what they have to do? Surgery. Surgery has to be done to open up the aorta. Patient has history of hypertension. Whenever your patient has hypertension, always check the blood pressure in both arms. And also, I want you to write down when you're checking blood pressure in 3 positions: laying, sitting, and standing. When your patient has hypertension, prevent orthostatic hypotension. Tell the patient to get up slowly. Depression leads to somatic ways. Underline the word somatic. What is the meaning somatic? It says complaints and pain. What does somatic mean? They're not really sick. But what is somatic problem are? I'm having headache. I'm having pain. I'm having chest pain every day. But if you do tests, they're normal. So what is the meaning somatoform are? They're really not sick, but they complain. I'll be clear, complaining of different pain and different sickness. But what is one of the reasons for somatoform disorder are depression. Underline also depression, and also sometimes patient reduce anxiety by complaining. Write down that. Maybe sometime to get attention. And I have done in mental health. Somatoform are patients who complains, and what is one of the reason is depression and attention they want, and anxiety. Next is cystic fibrosis. What did I say in cystic fibrosis? Problem. What are the problems are? Respiratory, number 1. So write down, and on the side, cystic fibrosis babies have problem with respiratory. Remember, they are not getting enough oxygen. Why? Because the body fluids are very thick. So phlegms are thick, and the lungs are not open. Any toys you give them, anything sit, and they can play. because their lack of oxygen. So first is the lungs are affected. You can also give CPT, you can give oxygen, and you can give bronchodilator. Second thing, pancreatic enzyme in GI is not there, low. Diet question, what do you cut down here? Fat. And what do you give them? Pancreatic enzyme with food. And give them vitamin A, D, E, K. You can give more everything but cut down fat. Number 3, they're losing salt through the skin. And babies are very salty. Increase salt in their diet, sodium. Number 4, it can lead to sterility. They may not produce children when they grow up. So cystic fibrosis disease is in the children. There are 4 problems. Number 1 is lungs. Number 2, GI. Number 3 is the salt. And number 4 is the sterility. So you have only one thing here. But remember, there are 4 problems. These are exocrine gland disorder, and childs are not having enough GI problem. They're losing salt and breathing problem. When you do PPD, TB, 5 mm, if your patient is immunocompromised, is positive. 10 is for your normal patient, is positive. 15, if you're living where TB is not common or rare, is also positive. So remember, 5 for immunocompromised, 10 for normal is high. Next line, hemoglobin A1C. Which patient do you do? Diabetic patient. Test. It's a test for diabetic. What are you checking? The blood sugar. It's a blood test. How often do you do? 90 to 120 days. That means every 3 to 4 months. The normal is 4 to 6 is your normal reading. That means the blood sugar is running normal from 70 to 110. But if you go 7 and more than 7, that means the blood sugar is running high. So they really want to keep the patient's blood sugar 4 to 6. So what is a test? It's a blood test. You're checking for diabetic patient. I will go underneath is BSA word, body surface area. Calculating the medication. Now we all know you look weight and height, but body surface area is important. Next is wheelchair. When you're moving wheelchair, you're keeping on the bed side on the weakness parallelly. If your patient is paralyzed and you're moving with help, so put them is to the side. One nurse discover another nurse and you make a mistake. What you should do? Now we always say notify your supervisor. Some books it says you talk to the person who is making mistake first before you go. But I'll tell you, would be the best answer, I think, to notify your supervisor. But sometimes it's okay, some question you are giving right away, something wrong, you got to correct and you tell them. Sepsis and anaphylactic reactions is with hemorrhaging, reducing cardiac, which lead to, underline the word, reduce preload, volume of the left ventricle. That means when you have anaphylactic, it reducing the heart load. Amniotic fluid, when mother rupture the membrane, you check amniotic fluid, and how do you check it? Nitrazine, it turns the blue. Another test is called Fern test. I want you to write down, there is another test is called Fern test, and I want you to write down, how do you check? Under the microscope and on the slide. You have to put the amniotic fluid on the slide and they examine under the microscope. The other one, you're using the strip, and the strip is turning blue. That is on your strip test. Next is, so that is on your amniotic fluid question. Next is gonorrhea. Gonorrhea is reportable. What is gonorrhea mother has can lead to the babies or blindness. And ophthalmia neonatum. That's why you put the eye drops in baby's eyes. Write down the word is blindness, and I will write down the word ophthalmia. Ophthalmia means is eye. Ophthalmia neonatum. Blindness. And why do you put the eye drops in baby's eyes? Are to prevent ophthalmia neonatum. That may be in a word question. So what is ophthalmia neonatum? Blindness. And gonorrhea is reportable disease. Now we already said DKA. You must know you're going stairs up and down. So it says for stairs with the crutches. The good leg when you're going first up, and then you use the bad leg. Opposite when you're going down, then you will be using is with the following up the different ways. So make sure everyone, when you're taking exam, you know your crutches, you know your how to use the crutches, measurement of crutches, and also how to go upstairs, swing through crutches. You all should know, have all in my notes. If you haven't done, you can come and I can go over. But you must know your crutches. DKA is monitored for intracranial pressure, polyuria. When you have polyuria, it's also sign of hypercalcemia in hyperparathyroid. Hyperparathyroid, too much of calcium. But that means when you have calcium, you can also have one of the signs is polyuria. Vasopressin. What is the meaning vasopressin? Underline the word vasoconstricting. And where do we use vasopressin? Two places. Write down diabetes insipidus. What happened to the patient with diabetes insipidus? They're peeing more. Be clear? Polyuria. So what happened when you give vasopressin? They won't pee more and they won't drink more water. Number two, you will use vasopressin in GI bleeding, when patient is GI bleeding because of vasoconstriction. So vasopressin is treatment for diabetes insipidus and GI bleeding. Water intoxication. Next one. Why do we monitor water intoxication? Too much of water in the body lead to what? Write down on the top, ICP. And what do you monitor? Level of consciousness. Drowsiness. Patient, what is level of consciousness? Drowsiness. So you're monitoring water intoxication. I want you, which patient are you monitoring water intoxication? Patient with TUR and add their P. What is TURP? They're removing the prostate gland through the urethra. And what you are giving with TURP patient R is, write down the word CBI, continuous bladder irrigation. So which patient you are monitoring water intoxication? Number one, when you are irrigating the with lot of water, patient has water intoxication. Where else do you monitor water intoxication? I want you to write down on the other side, hemodialysis patient. When they're going in dialysis, and remember, when your body, you're giving too much of fluid, lead to water intoxication. The meaning is cerebral edema. The meaning is too much of fluid. What do you monitor? Answer would be, what is another condition you monitor? I want you to write down the third disease, SIADH, opposite to diabetes insipidus, is called syndrome of inappropriate antidiuretic hormone. What are they doing here? They're not peeing enough. They have too much of ADH and urine output is low. So urine output is low and they're having edema. Remember three things here. Water intoxication means too much of fluid in the body, leading cerebral edema and leading into ICP. What do you monitor your patient? Level of consciousness. Last line on page number 34. Burning sensation is symptom or side effect of Lugol solution. What is Lugol solution? Are you are using for which patient? Hyperparathyroid. It's a medication. How do you give Lugol solution? By mixing with the water or juice and use the straw. So, and you do have on page number 35 hyperparathyroid, and notify a patient has burning sensation or brassy taste. That means side effect. But remember, you're using for hyperthyroid patient. And what is the medication is called? Make sure we know the wording, anti-thyroid medication. Next one, synthroid. What is synthroid is thyroid hormone. Write down there, thyroid hormone. When do you give synthroid? Which patient? Hypo, and also after thyroidectomy. What is the best time you give them? Empty stomach. What are the side effects of the medication are? They are turning into hyper, tachycardia, chest pain, insomnia. Insulin, you need to give more. In the next line, when you are giving prednisone, what is prednisone? Steroid. What does it cause? Hyperglycemia. And that's why you need to give insulin. So remember, all your steroids increasing sugar and decreasing calcium. Non-fat milk, you will give them, underline the word esophageal sphincter pressure, or underline the word reflexes, GERD patient. What do you do for GERD patient? Raise the head of the bed and cut down the fat. Patient with GERD should lay on left side and raise the head of the bed. Those two things are important. Diet, to cut down fat. Low Fowler's position with patient with dumping syndrome. And what do you cut down in the diet? Limit fluid, second line. And I want you to write down limit carb, because carb digests faster. You can increase fat. So, number one, dumping syndrome, low Fowler's or recumbent position. Cut down carb in the diet. Cut down fluid, small and frequent meal. Emphysema patients, we already talked about that. Pursed lip breathing. Patients should be, and give them give them 1 to 2 liter oxygen. Fluids is good. Position high Fowler's and leaning forward. That means they're sitting more like in a tripod position. Theophylline. What is theophylline? Bronchodilator. And what do you monitor? Give them with food. And theophylline level. What is a normal theophylline level? 10 to 20. TB patients medication, you monitor liver, and what do you monitor? Peripheral neuropathy. And I want you to write down the medication, INH. INH is your TB medication, and before you give them, you check liver. And what do you add for peripheral neuropathy? Write down, you increase B6. B6 is to prevent peripheral neuropathy. So we finished our package, and everyone, we memorized that. Go through that.